When somebody has a stroke, it not only impacts them, but also impacts their family. And the decisions that person makes after they've had that injury to their brain really will determine what their future will hold for them. You know, in other words, if a person decides to not pursue therapy and address some maybe changes that they've had in their thinking skills or their speech or their ability to find words, that can really impact your outcome down the road. You know, do you return to work? Are you able to have good conversations at those family events still?
Well, and don't you think, Jody, that at one point people would think only elderly people had strokes?
Yeah, definitely.
The youngest stroke patient I've seen was, 26 years old. Yeah. You don't have to be elderly to have a stroke. And so looking at, fast tracking, being able to see gains so that you can get back to your highest level of functioning is always our goal. So some people have already received some care, maybe inpatient. Know that if you feel like you feel like you're stuck, like maybe you haven't made the gains that you'd really like to or need to, give us a try. We can quite possibly help you, and even if you've received treatment already.
I think that's a good point where we would come in too, is that people have tried certain types of therapy, and I think we have a way of taking it to the next level. Yeah.
And we're not saying other treatment hasn't been helpful, because routinely it is helpful. But when you're just looking at additional options, more individualized care, how do we...
There's different phases.
Right, absolutely. I find, some people have made a significant improvement in their recovery, and, their husband or wife maybe shares after their stroke. They've really made lots of gains. But maybe they feel like they're only at, 50% of their baseline or 50% of their normal. Any percentage or any amount improved from that is a quality of life change.
Well, just because a person's done therapy does not mean they've completely done therapy, I think of a number of people I've worked with where they've gone through therapy and graduated, and yet something was off the mark. It wasn't quite there. And the nice thing is that we're able to provide therapy that's maybe a bit more customized to that person's needs and really help them to get to a level where they're functioning better.
Yeah. I think you're referring to the progressive way.
It is a specific way, I will say that, which is also why with our therapists, when they join our clinic, we have an intensive oversight. We really oversee what people are doing therapy-wise, so they are trained a specific way, the way that we want therapy to be provided.
And I feel like that impacts the outcomes of our patients and families quite significantly.
Yeah, I would agree. Yeah, because what we do is it's very unique, it's very specialized. You're not going to find it everywhere. Yeah. Actually, it's almost a rarity.
So it makes me think of the example of the therapist I was indicating to you that was doing this test with this young man, or this man, for medication management, and he was having no trouble with his meds, but because on this particular tool or test in the office, that was right? I mean, I think
not functional.
Right.
But don't you also think too, though, there's a number of different people who have come through our doors where you kind of hear about their experience with therapy, and that was good, but it also left something to be desired too.
There might be some gaps.
Yeah. I mean, there was one individual specifically that I worked with who graduated therapy, but when he got to me, he still wasn't independent with his hygiene or remembering to clip his nails, or really a full active member of his family, but he thought he was because his insight was so impaired.
Yeah, and when you're looking at self-cares, that requires attention and memory and planning and following through, which is all of what we treat every single day.
Yeah.
And our testing is important, but when we're looking at how does that mean this person applies this to their day-to-day life, how does it allow them to be, mom again, dad again, or back to work, those things are immensely important.
It's probably one of the biggest reasons why we're unique, actually, if you think about it, because we want to know, though, what's breaking down, how is it breaking down, and then what do we do to help you to make sure that that's going better for you.
Right.
We really dig in there.
Right.
We get to know people, that's for sure.
Of course, we can't write treatment goals that say patient will become mom again, but we are building skills so that they can be mom again, right? Can do life again, can navigate themselves and their responsibilities with improved independence. Probably the greatest reward.
Especially when you see someone just light up and be excited that, hey, I remembered to shower every single day this week, or I called my kid on their birthday. Things like that.
When you think about brain injury or stroke patients that I've seen, and I'm going to use the mom example again, there's a lot included in that role of being a mother. And when this patient indicated to me her adult children had sort of changed roles because of her needs secondary to her brain injury, and had sort of been more like the mother role when she was able to get back to taking on her own responsibilities and being mom again. Quite a victory.
Yeah, and there is that point where a person needs that help and that guidance because they are healing from an injury to their brain. But then eventually you want to kind of switch back to what were the typical roles. I mean, that's what everybody wants.
Yeah, it evolves, but it takes very specific, well, for us it takes very specific, we get to really know our patients, specific steps and actions.
We really get to know our patients.
What was your normal? Right? We have to really get in their
How
business.
How are things different?
To be able to help them.
Yeah. Sometimes it's getting information from the family members as well, because what they might say is same or different is different than the patient would say.
That awareness or insight of how am I really doing?
Yeah.
And then husband or wife or friend says, oh no, 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 no. That's not quite how I see it. Yeah, taking those pieces and applying those to treatment. We see lots of gains with that.
I guess if you know someone who's had a brain injury or someone who's had a stroke, kindly suggest our name to them, Progressive Therapy Associates. We provide really, really good customized therapy, and I mean, you'd hate to see someone miss out on the possibility of improving further.
Right, and one of the things that we also pride ourselves on is, people could do a free consultation or call our office, and if the services we provide are not a match, we also are open and honest with people, and
yes,
we pride ourselves on knowing what's in our community, and so it's never a waste.